Hi, do you mind
Hey there.
telling me who you are?
Yes, I'm Nancy Krieger, and I'm a professor of social epidemiology at the Harvard T.H. School of Public Health, and also chair of the Spirit of 1848 caucus of the American Public Health Association, which is concerned about issues of social justice and public health.
You've been doing some amazing work about raising awareness about inequalities that COVID-19 is surfacing, and not only in Boston, but across the US. But before we get into kind of the specifics of that stuff, I want to ask you, how has COVID affected you personally? And I mean not only at a personal level in terms of illness, but I also mean in terms of your work. What's changed in terms of areas of focus, or even how you do your work? How has COVID affected your own life?
COVID has affected me personally in many different ways. There's great concern for some of my friends that have had family members affected, and concerns about how people are doing in my community. So there's a lot there. The disruptions, and not just for people that are themselves personally ill, but are worried about loved ones elsewhere. I've watched my students have to deal with all kinds of different family situations. So there's a lot that's about the stress and the turmoil and not knowing what's going to happen. Watching my nephews have to figure out what does this mean for their jobs going forward. It's like many different things that hit. So there's a lot of concerns that play out that way. But in terms of my work, what I tend to tell people is that I now feel like I'm doing 3 jobs and working harder than ever. So job number 1 is my usual job. Job number 2 is dealing with all the COVID-induced disruptions to my usual job, which are myriad in terms of the research, in terms of the teaching and everything else, and all the institutional issues that have to be dealt with. And it's not like somebody added more hours to the day. And then I was not initially doing work on COVID. I still have all my other research projects, but my sense of public health duty impelled, and I've been putting a lot of time completely unfunded into doing the COVID work because, you know, even if there are only 24 hours a day, you can pretend that there are 48 and basically say that your work is being fueled by, among other things, sleep deprivation, which isn't great, but is necessary nonetheless. And what's very weird about it is working harder than ever and not leaving my home.
Oh, I very much understand where you're coming from. So when you think about the communities that you work with and the communities that a lot of the research you've been doing around COVID lately, those communities and how they're impacted, what do you think are some of the concerns, not just in the immediate, but going forward? What are some real things that we all need to be keeping in mind?
Partly there's what I see immediately around me, and partly because of what happens with the Spirit of 1848 listserv, which has been posting endless amounts about what's going on with COVID-19. And we, with Public Health Awaken, generated a COVID-19 health and justice resource, a living document that people keep adding to. And the economic devastation, as well as the health devastation, is enormous and is going to be continuing. And it is making some of the economic inequities that are racialized in this country even worse than they were before. There's many ways to imagine, especially with different leadership, what a better recovery would look like and what the possibilities would be to center that around equity in so many different ways. There's also real fears that it could go even worse than it is now. But the economic consequences, I mean, there are so many people that are food insecure now that are worried about being evicted. You look at the household pulse surveys that the census has been doing, and the data are absolutely alarming. 40% of renters of all race ethnicities are worried they're going to get evicted in 2 months. So there are huge failures that were there. Often when people think about disasters in the US, it's like they're terrible. There was the horrible fires that you've all been having, or there have been the horrible hurricanes, but they're local and they're usually time limited. Mm-hmm. This is all over the place and it's not time limited.
That raises a policy level set of questions. And I guess
lots,
right? I mean, like, okay, I think the question is, if we start thinking about the policies that are most of concern that have come into being around COVID, when you think about that, what are some things that you think that are some of the policies we all need to be paying attention to and worrying about? And again, you can go federal if you want, but I also think that more local is also kind of where there's a lot happening.
Well, and they also intersect because sometimes what federal does interferes with what locals want to do. There's 2 different parts here. So one is the key thing about doing something about this pandemic is stopping exposure. And a lot of the exposure is occurring actually around things that have to do with work or else some public venues. And so either there have to be national policies, local policies, whatever, about paid sick leave if you're sick and you can't come to work. And those have to be mandatory. And there has to be mandatory OSHA guidelines, standards for COVID-19. And there, I mean, it's been a travesty of what's happened, and that gets played out mixed between the federal and state OSHAs. So the lack of protection at work is huge in part of what's going on, the lack of physical protection and the lack of economic security protection with regard to also health insurance, because so many people in this country are reliant upon some version of something called a job to have something that might be called health insurance. When you end up losing your job and then losing health insurance and then having to try to get health insurance, and meanwhile you've got a government that's trying to, administration that's trying to kill Obamacare, which is not exactly helpful, not to mention also not be favorable to Medicaid expansion in the states. So that's really a problem. A huge part there about what needs to happen to prevent people from being exposed in the first place. Then there's the devastation of people who are exposed and are ill, and how is their testing going to get covered? There's been complete inconsistency. Even though the tests were supposed to be free, there are places that are charging. They're charging dramatically different things in different places. Welcome to the insanity of an unregulated market once again. And it's really bad.
Let me try to move to the positive for a moment, okay? So there's a lot about the policies that exist that we know are harmful. Have you seen any good examples of what states, of what local governments are doing to effectively address COVID?
One thing that's been good is, a reminder, what is government for and who is government for? And people stepping up to say that government is for actually protecting the health of the people and protecting people's well-being. It's not just about protecting private wealth and deregulating like crazy in order to do that. And people stepping forward with really expansive visions to make sure that whatever workers are covered, it includes domestic workers. There's been a lot of organizing around that. There's been a lot of organizing around saying that where those monies need to come from to help improve human services is to reduce, for example, excessive police budgets, ways of beginning to look, making connections, or the people that are also looking to see how government has actually acted decisively in ways that have been called for years around climate crisis. Mm-hmm. And again, government can act. The question is, will it? And on whose behalf?
And are there places where you've seen that government is acting?
I pay a little bit more attention to Massachusetts being, provincial. And, the eviction ban has been in place and is being extended, and that's important. There's still a lot of work being done to try to push forward and extend the unemployment relief, et cetera, and those packages, but there's been some of that work that's been important.
I guess my last question is just taking a step back. I mean, if we think about who we are as a society, are there some key lessons? Do you think there's anything we can take out of this experience that we think that we've learned as a society that can help move us forward?
I wish there were an unfragmented we, but I don't think there is right now, Sophia. I think that things really are polarized and fragmented. I think that clearly, the responsibility for figuring out what kind of communication happens, particularly on the internet, so as to reduce the amount of disinformation, which has been absolutely enormous and really harmful and further leading to splintering of people to lots of little groups that are beyond their own echo chambers, is really alarming. So I think there's a bigger lesson, which is remembering that we actually do live on a biophysical world, and it's the one planet we happen to inhabit, and there are things that spin off as a result of that, and viruses could care less what we believe. They're just looking for a host. So I think there's a recognition, maybe of some people, that we actually do live on this planet, and we have to understand what it means to live as human beings on this planet. That would be a good thing. Another thing is that in many ways, this pandemic, precisely because of how the virus is transmitted by air that we share with fairly fast infection, it's not like you're waiting years and years for it to show up, as might be, for example, like with tuberculosis, which can also be transmitted by air, is it shows how connected people are. When you do the contact tracing, you do the roots, you understand the ways in which people's lives are entwined with so many other lives. And that's a wonderful thing, understood in positive terms. And that's why I've said repeatedly that this pandemic has pulled the thread. And the question then becomes to see what all our connections are. And the question then becomes, well, what do? Do you just further tear at the seams, or do you go back and build the quilt?
That's a beautiful way to say it, honestly. Thank you.